Thank you for joining us today for a special Diabetes Alert Day webinar as part of the South Dakota Diabetes Educators Network. My name is Ben Tinswold, and I am the coordinator of the South Dakota Diabetes Coalition. And I want to preface this presentation with sharing that I do not have a healthcare background as far as being a nurse or a dietitian or anything like that. I'm looking at this more from an evaluator's perspective and looking into our topic today for Diabetes Alert Day, which is data-driven conversations with providers, and learning to use the data within your electronic medical record to share information with providers about diabetes education and diabetes prevention programs. So just a little bit of a background and overview in case you are not familiar with the Diabetes Coalition. The South Dakota Diabetes Coalition is a volunteer-based nonprofit here in South Dakota that works to collaboratively improve the quality of life for all South Dakotans at risk for or affected by diabetes. And so today, March 26th, is the fourth Tuesday in March. And so the American Diabetes Association has identified today as Diabetes Alert Day, a wake-up call that focuses on the seriousness of diabetes and the importance of understanding your risk. And so for those of you who are diabetes educators and providing diabetes education to patients and working with providers and trying to increase referrals and doing all kinds of work surrounding diabetes education, you know that every day is Diabetes Alert Day. I'd be preaching to the choir if I shared a bunch of data about diabetes because everyone is familiar with the increase in diabetes prevalence, the increase in pre-diabetes prevalence, etc. So I won't go into any of that data today, but I do want to give a shameless plug for the diabetes prevention resources that are available through the South Dakota Diabetes Coalition. These are free to order, so you can reach out to the Diabetes Coalition to order these materials. We have the Type 2 Diabetes Risk Test Card. This is simply an adapted RAT card to not be a full 8.5 by 11 size sheet of paper as the CDC originally designed it. And then to follow up, for those who score high on the risk test, there's the What is Prediabetes card. And this card provides local information with South Dakota specific data regarding prediabetes. So if you're interested in obtaining those to use at the health fair or to implement in your facility or just to use with friends and family members, certainly reach out to the Diabetes Coalition to obtain those cards. So just a few quick definitions here. I won't read through the definitions word for word here. I'll just leave them up on the screen here for you to take a quick look at. But I just wanted to make sure that before we jump into our conversation today that we have standard definitions. Diabetes self-management education / training / support. We'll be referring to it primarily in this presentation as DSMET, but it also, depending on who the payer is covering the services, it can range from education to training to support. And then we have the National Diabetes Prevention Program, or NDPP, and we just specify the national part of DPP as that is the official CDC recognized lifestyle change program. There are other programs, examples through the National Kidney Association that are considered diabetes prevention programs, but they're not the same evidence-based program that the CDC promotes. And then also identifying what prediabetes is, just so that we are aware of that term as well. So just a quick background before we jump into the data piece here. The information provided in today's presentation was developed by a work group of the South Dakota Diabetes Coalition that was working to increase referrals to diabetes education programs. And so a big part of this work group was developing this fillable form to visualize and summarize diabetes data to promote conversations with providers. And so we will jump right into using this fillable form here. It's actually a pretty simple tool And I'll be sharing this with everyone with the South Dakota Diabetes Educators Network so that you have this form available. I'll also post it with the recorded webinar on the Diabetes Coalition's Facebook as well. But this fillable form is meant to be used to calculate out the data from electronic medical records regarding patients with diabetes. And so this form can be used in many different ways. It's a very versatile form. It is pretty to look at, but this might not be what you'd want to share with the provider at the end of the process of completing this form. But we'll jump into this a little bit further. As you can see here in the form, there's different areas that ask different data, and there's different places to fill in that data as well, based on what you're trying to pull from the electronic medical records. But the main question that this form asks is, if diabetes education were a pill, would you prescribe it? So we're going to look into that a little bit further here as well. So first, when you're looking to pull data from the electronic medical records regarding patient participation in diabetes education, or number of patients that a provider sees who has diagnosed diabetes, etc., you want to just define what data you're pulling. So for this scenario, it is all completely made up data, as I don't have access to any medical records, and I wouldn't be able to share that if I did. So this is all made up here. So we have Dr. John Smith, and the patient demographics that we're using are all patients age 18 and older at Dr. John Smith's practice at the Main Street Clinic. So primarily looking at only at adults here age 18 and older, and only looking at those that Dr. John Smith sees at the Main Street Clinic. So the total number and percentages that we're calculating for are based off of a starting number of patients of 912. So Dr. John Smith sees 912 patients. So then we can jump into the calculations here. So the first calculation we can look at is the number of patients who have had an A1C check within the past blank month. So for this equation, we're checking to see how many patients have had an A1C checked within the past 12 months. So of Dr. John Smith's patients, his total of 912 patients, 442 have had their A1C checked within the past 12 months. And so, as noted here on the screen as well, this calculation can help the provider understand the percentage of their patients who are having their A1C checked. In an ideal world, this number would be 100%. We'd want all of the patients age 18 and over to have their A1C checked at least once a year, assuming that they're doing blood work and things like that. But I'll leave it up to the professionals to officially discuss that and review. But for this scenario, we have 48% of the patients have had their A1C checked within the past 12 months. So using that A1C as our identifier, we can then take out of the 442 patients, 182 have diabetes or have an A1C greater than or equal to 6.5%. And so this right here is actually a number that could be larger, because there was only 442 of 912 patients who had their A1C checked within the past year. So of those patients, the remaining that didn't have their A1C checked within the past year, some of those patients may have diabetes but are not aware of their diagnosis because they haven't had their A1C checked. Or some may be aware of their diagnosis because they were diagnosed with diabetes through a different method. But specifically here, we're focusing just on the A1C to further identify here what the patients within the practice of Dr. John Smith how many are identifying as having diabetes. So next we jump over to further calculations here. Over here on the left-hand side, it provides the total number of patients with diabetes, A1C greater than 6.5, who have had an A1C check within the past 12 months, and the total number of patients with diabetes, an A1C greater than or equal to 6.5% who have had an A1C checked within the past 6 months. So this just allows you to further streamline down that data here too. If you wanted to really focus in on having an A1C check every 6 months and showing the provider how many patients have had an A1C every 6 months, you could calculate it that way. I realize now that the total number of patients with diabetes greater than or equal to 6.5 who have had an A1C check within the past 12 months, I maybe should have not included that one in here because we had it on the previous slide, and I realized that number's different. So forgive me there, we're making up these numbers because we don't have real data, but just showing how to go through it here. So as you can see on the right-hand side here, we have the total number of patients with uncontrolled diabetes or an A1C greater than or equal to 9%. And so of Dr. John Smith's patients, 9% of the patients with diabetes, or 17 patients, currently have uncontrolled diabetes. And then we can also identify the total number of patients who have attended diabetes education, or in this case, DSMET, as we're calling it for today's presentation. So when we look at that, we can then gather some data from the electronic medical records that we can share back with the provider. But before we jump into that, we can even take it one step further, depending on our sample population that we pull from the electronic medical records, and look into calculating a reduction in A1C based on the use of diabetes self-management education. So when looking at that, we have a way to calculate that out as well. We would average out the A1C of patients prior to attending diabetes education. So in this case, our made-up number is 8.2% is their average A1C, and then an average A1C of patients after attending diabetes education, which their A1Cs dropped down as an average to 7.6%. Compared to those who did not attend diabetes self-management education, they had a first average A1C of 8.1%, followed by a follow-up A1C of 8%. So as we know, the use of diabetes self-management education as a tool for caring for patients with diabetes can decrease the A1C. I have the source statistic on that original infographic that I don't have on the slide in front of me here, but I believe it was by 0.6% reduction. So this is a tool that you can use here. This is kind of getting into the nitty-gritty with the provider if you really want to hit home the importance of diabetes education. And this would be something that you might have to take a little bit longer to go through and calculate, and you might even want to reference, we had the first A1C check here for the patients, whether they attended diabetes ed or didn't attend diabetes ed within the last year. And then after those individuals who attended diabetes ed attended, then we calculated out the averages in the past 6 months checkup. So that's something that you'll really need to dig in a little bit deeper into your electronic medical records, as each one is different, and really go through that further. So looking at all of this data here and pulling all of this data, it does take a little bit of time to pull it all. It didn't take me very long because I'm just using made-up data, so that was very handy. But for individuals who are diabetes educators and working with their team and going through this, it can take a little while. But in the end, we come to, here I had a slide here showing the reduction in A1C continued. We have that final area to show the change there. But you can come to an overview that you would then share with the provider. So based on the data from Dr. John Smith's practice, we can share these 6 bullet points with Dr. John Smith. And so that would be, Dr. Smith sees 912 patients over the age of 18 at the Main Street Clinic. Of Dr. Smith's 912 patients, 48% have had their A1C checked within the past 12 months, and 182 of Dr. Smith's patients have confirmed diabetes. More could have diabetes but have not had an A1C within the past 12 months. And then looking into diabetes management and diabetes education, of the 182 patients, 62% had their A1C checked within the past 12 months. Again, that was my little error in calculating this. That would actually be all 100% of those patients within the last 12 months. Is that how we confirmed over here that 182 patients have confirmed diabetes. But looking into the past 6 months, 45% have had their A1C checked within the past 6 months. So that could be something to address with Dr. John Smith. And then 17%, or as you remember, or I'm sorry, it should be 17 patients. We're going to take out that percentage sign there. 17 patients, or it was 9%, or 1 in 10 of Dr. Smith's patients with diabetes have uncontrolled diabetes. And then 37% of Dr. Smith's patients with diabetes have attended diabetes self-management education at least once. So this gives us a quick overview of what we would then want to report back to the provider. So I will take a brief pause there and unmute the lines here if anyone has any questions or comments before we move on with a little bit of information about sharing the data with the provider. Any questions or comments? Great. Well, we will move on here a little bit further to, now that we've identified the data we would like to share with the provider, I just have a couple tips for sharing that data with the provider. So to present the data to the provider, as we know, everyone is busy, so we want to plan ahead. We don't just want to pop into the provider's office and say, let me share some great data that I found from the electronic medical records with you regarding your patients with diabetes. We want to plan ahead, and that allows us to prepare the data using this fillable infographic beforehand. And then draft an outline. So that could be previously where we had those 6 bullet points we wanted to share. And then, of course, schedule the meeting. Depending on the provider, consider including the provider and their staff in the conversation. Some providers work really closely with their nurses and other support staff and would like to have those individuals present just to hear the information as well. Be confident throughout your discussion and follow up with the provider after the conversation. So if it's something that you're really nervous about, or you really are a little worried about visiting with that provider and sharing data, maybe their data isn't looking too great, you certainly might want to draft an outline for yourself, not only of the data, but how you'd like the conversation to go. And then don't be afraid to role play the conversation a little bit with a colleague so that you can prepare for the conversation as well. And then after the conversation, you certainly want to follow up with the provider. So maybe send that data again in an email as a follow-up. Maybe you send over your business card, depending on how the conversation went. Maybe you send them further information about continuing to refer patients or what other help that you can provide their patients, et cetera. It really depends on how the conversation goes there. So in addition to presenting the data to the provider, you may want to find a physician, in parentheses, provider champion, within your organization. So you can have multiple physician champions or provider champions who can influence other providers. You might have one provider champion who tests every single patient, or 90% of their patients once a year annually to test their A1C. And you might have one who is really great at referring their patients to diabetes education. And so that provider might be one that you'd want to visit with and befriend a little bit further and obtain a quote or two from, further emphasizing the importance of diabetes education. And then you might have a provider who is really good at sharing with their patients that they do have prediabetes and sharing information about diabetes prevention programs, or sharing information about how to decrease or prevent the onset of type 2 diabetes. And that form as well is really versatile. Again, it's just meant to be used as a template. So you can certainly calculate out, rather than the number of patients with diabetes, you can calculate out the number of patients with prediabetes and have that be something you might want to share as well. So don't be afraid to reach out to those provider champions and obtain a quote or two from them to share with the other providers. Conveniently, Dr. John Smith's coworker, Dr. Jane Doe, is really great at referring her patients to diabetes education, and her data displayed that. And so we've reached out to Dr. Jane Doe and obtained a quote. She said, "I found that my patients who attend diabetes education come back with a better knowledge of the disease and how to manage their diabetes." And since Dr. John Smith and Dr. Jane Doe work really closely together, that only further emphasizes the importance of diabetes education and might make Dr. John Smith realize, oh, well, Dr. Jane Doe is referring her patients and is pleased with that. I should start referring my patients or refer more of my patients to diabetes education. So that's just a little bit of information about having that conversation with the provider, and then also utilizing physician champions or provider champions to further emphasize and connect with other providers. So I will, again, unmute the lines here before we move into our discussion questions. Does anyone have any questions about using the fillable infographic? Any comments, any concerns?
I think you covered it pretty good.
Great. Well, hearing no comments or concerns or questions, I'm now going to jump into our discussion part of our South Dakota Diabetes Educators Network Special Diabetes Alert Day webinar today. And we don't have to spend our remaining 35 minutes discussing these questions, but certainly if we could just take a few moments to discuss a couple of these statements and questions. It would help if I pulled them up here. And then we can also offer these discussion questions to those watching the recorded webinar for them to think about as well. So our first question here is, have you ever pulled EMR data regarding diabetes prevalence, A1C frequency, diabetes education referrals, or any other variables related to diabetes care? And if so, what advice or tips would you share with others?
So Ben, this is Sue. So I just want to share a little bit about a couple of projects that Avera System has done. We took some data specific for diabetes education. So we did 4 models of care, provision of education with specific patients, regardless of who the providers were. And one of the things that we discovered is that regardless of the source of the educational component, so whether it was a NP, PA, a CDE, or the diabetes center programs, that all of the educational programs prove that education does promote reduction in A1C. So generalized reduction in A1Cs, anywhere from 1.6 to a full 2-point decline in A1Cs, was noted with checking a hemoglobin A1C prior to the educational opportunity, and then approximately 6 months post opportunity, Ben.
Great. So as you worked with Avera and pulled that data, do you have any advice or tips that you would share with others?
I think a general look, we selected particular providers to do some post-educational follow-ups. And what we noted was that that the educational things that we provided seemed to be sustainable for a period of time, but we suspect that will decline. So we use that as an opportunity to have a discussion with our providers about follow-ups, and that has seemed to work pretty well, Ben.
Great. Anyone else who would like to share their advice or tips when pulling electronic medical records data?
One thing we did, because I don't want anybody to feel like they're being singled out, but going through the program, we look at that to see if we're doing our patients justice and what our outcomes are, behavioral and A1C. But then for a yearly letter to the practitioners in general, we can say, hey, this is the outcomes of our program. And, it's only been the last few years that I really worked on doing that. We've always done it here and with our advisory board, but when we're working on all of that data, in general, without having to, work with anything that would be HIPAA or that would be difficulty between clinics, it's really helpful to just share that data with everyone.
Sure, that's a great point, and something I realize now I should have brought up in the presentation as well, is maybe you don't want to single out a specific provider, maybe you want to single out a specific clinic and present to all of the clinic staff in a meeting about, overall from the 6 providers here who cumulatively see 3,500 patients, X percent of them have had their A1C checked in the past year, and Y percent of them have diagnosed diabetes. You don't have to single out the John Smith provider. You might include John Smith and Jane Doe, both of the providers at the clinic, and just give an overall view as well. So that just touches a little bit further on different ways that you can use that fillable infographic to pull the data. So next question here, have you identified a physician or provider champion? Have you identified more than one? Maybe you have one who's really good at testing for A1Cs and one who's really good at referring to education. And if you have identified them, how do you continue to build a relationship with that champion?
Well, for one thing, it's just a simple thank you letter. A yearly thank you letter for the top 5. One other thing we have done is just as soon as we get an order and we get somebody scheduled for class, I'll let the doctor know by fax, hey, we got them scheduled, so that they're kept well informed of the process, because in our situation, it might be 6-10 weeks before they get through class, depending on how many times they miss class and when they get scheduled and what works. But at least that way, just keeping the practitioner appraised of what's going on. Yeah, they scheduled or whatever it is that's going on. And when we're done in the end, I always give them a summary letter. Hey, we're done. We're going to be meeting for 6-month follow-up and such a day. Here's their goals. Ask them about that.
Okay, great. So it sounds like some of the provider champions that you've identified are those who are actively referring their patients to your Diabetes Ed program. And then that kind of goes along with what we discussed today earlier about following up with the provider. So perfect. So our next question here, I think we've already answered a little bit here. Have you presented data findings to a provider in the past? How did that go? And what are your key takeaways when connecting with a provider? But anything that kind of blurred a little bit with our first question here, but any other information you'd like to share or tips for those diabetes educators who maybe haven't presented data to a provider in the past?
Ben, I just think Susan's point about developing a relationship with your providers is extremely important, so that if their referrals go well, they should know about that. I think the providers are interested, and especially with all of the new data collection and all of the reimbursement based upon outcomes. So most of them will appreciate the information if it's presented in a very non-threatening manner. So here's how a system looks overall. Here's how your clinic looks overall. And if you're interested in your own data, we can do that as well. So sometimes starting big and then coming down to the individual provider works well.
Sure, sure. Then you're not so upfront with some data from the provider that might not look too well. So in contrast, have you run into any trouble with providers? Have you heard about a provider who doesn't refer to diabetes education and or providers who may not share with the patient a prediabetes diagnosis? And if so, how do you mitigate or respond to those concerns? And maybe that hasn't been a problem. Maybe everyone on the call today has had positive experiences with providers and haven't had to go down that road. So certainly something that not everyone might run into, but if you do run into it, what are some possible ways you might mitigate or respond to those concerns?
I don't know why, but the one thing that's I'm thinking of is we do want to order from the doctor. We do believe in working as a group, but patients can call us and say, hey, you know, it's been a year, I want follow-up, or I haven't had diabetes education, I've been diagnosed, and I don't have a problem getting the information from the patient and then going to the doctor or practitioner and saying, hey, you know, Susan said she's diagnosed with diabetes and would like education. Are you willing? Sometimes I think, you know, it's really difficult for a practitioner when you have 10, 15 minutes and you got somebody with a new diagnosis and, of course, 15 phone calls and I'm late getting in. Now I'm supposed to get diabetes education ordered and there's umpteen zillion different boxes on the, you know, form to fill out and the patient's not sure they want to miss. So any way we can help them make that referral easier. Certainly they have to make the diagnosis. I need the labs. But when I have a patient come, I'll fill out the form, send it out to them. I'm always trying to think not only from my perspective what I need, but also what way could we make it easier for both of us and the patient as well.
Sure. So it sounds like sometimes you work backwards and the patient reaches out to you and then you connect with the provider for that referral.
I think it's a continuous conversation about how do we make it more easy for the providers to get those referrals. So Susan's been in a conversation that we talk about the easy button so that the EMR facilitates the referral flow and makes it easy. That's not always a simple thing to do, is to impact a big system, but certainly that is ideal if you can make it so simple that your requests and referrals come directly from the EHR.
Great. Well, that was all of the discussions I had for today's call. I just wanted to thank everyone for joining today for our special Diabetes Alert Day presentation here. And I will be sure to share the fillable infographics form as well as post on the website as well, so that those watching the recording of this webinar can download that form. And like I said at the beginning of the presentation, I think for those who work in diabetes education and prevention, every day is Diabetes Alert Day. And so taking a little bit of time to pull some of that data and connect with providers can really go a long way, along with all of the other ways that we're working to connect with providers and to promote diabetes education and ultimately control of diabetes complications and hopefully prevent or delay the onset of type 2 diabetes as well through pre-diabetes education. So I just wanted to thank everyone again for joining us today, and I will go ahead and post this on the webinar for others to view.